within the Queensland Health Department, Arafmi has a lot to do with a particular area. It is the Mental Health, Alcohol and Other Drugs Strategy and Planning branch. And the Senior Director of that mouthful is Sandra Eyre. Thankfully, Sandra has seen some value in strategy and planning with Arafmi. And we'd like to invite you up here now, please, Sandra. Is it perfect? Anything else in your branch that I should have announced you're chief of? Good dresses. She's chief of good dresses.
Thank you. Thank you. And I'm just trying to do the conversion from paper-based, and it's not working very well, but anyway. All right, okay. Good morning, everyone, and thanks very much, Irene and team, for inviting me here today. And thank you, Ivan, for all the work you're doing, and Shannon for your story. That was quite inspiring. In the branch, we're meant to be like Switzerland with all our organisations. We fund many organisations and they're all pretty special. But I do have a soft spot for a couple, I think I'm allowed to say that. And Irene and Arafmi and carers is a little bit of a soft spot for me. And the other soft spot is that wonderful group of consumers who come and sing. So that's my two little soft spots from where I sit. So I don't think I'm upsetting any of the other organisations with that. Okay, so it really is a pleasure to be here today. I think I came last year, and I know previously John Allen, who is the Executive Director of the Mental Health, Alcohol and Other Drugs branch, has been here for years before that. And for those of you who don't know, John has just retired, finally, after a quite illustrious career. So he's only been gone about 2 weeks and we miss him a lot. I'd like to respectfully acknowledge the Yarra and Turrbal people upon which we're meeting here today and pay my respects to elders past, present and emerging. I'd also like to recognise people with lived experience of mental illness, mental health crisis, alcohol and other drug issues and suicidality. And those people here today and online who love, care and support people with a mental illness and support their recovery. So I don't need to tell you that carers are critical, and just by listening to Shannon we get that, but you will all understand that because that's what you do. But we do consider you an essential part of the health system. You play a crucial role in supporting loved ones when they're unwell and throughout all stages of treatment, care and recovery. That includes times of crisis and possible admission to mental health services, to participating, most importantly, to supporting people to participate every day back in the community. You actually are there when clinicians miss signs. I really wish clinicians would involve and speak to families and carers much more, and that really is a work in progress. But you're really there, and it's so important that you're able to provide all that information as part of your loved ones' treatment and care. So we actually think you're part of the foundation. We can't do any of the work we do in driving forward improvements to the system without you there as an important pillar. And my team have looked up, and you probably already know this, Arafmi have told us there's at least 500,000 mental health carers in Queensland. That's a lot. Yeah, it's a lot. But you actually contribute about $3 to $4 billion in the value of the care you provide to the Queensland economy. So that's pretty significant. And, you know, Ivan said that the Queensland government, you know, significant investment, about $2 billion for the next, however, because we've got a mental health levy, but $2 billion over the 5-year period for Better Care Together. Well, when you think about it, 3 to 4 billion, you're doing pretty well. We'll make up the other billion. Oh, well, you know, we'll look at that. Okay, so caregiving, of course, it's rewarding, but it can really impact your physical and mental health, and that's well recognised. And that lovely little take time out for yourself. And I haven't tried the spray yet, but I'm sure it's very nice. But one of the things, and this is where Irene and the team, supported by her board, have really raised the voice of you as carers and the issues you face, good and bad. Irene hasn't held back. But policy advocacy. So Irene has really driven that issue for us. But we need to hear all those stories so we can understand how we can improve things more for you. Now, I know the Commonwealth Government, Irene's just spoke about that actually, the National Mental Health Consumer Alliance and the National Mental Health Consumer Peak Body. There's too many of them. National Mental Health Carers Family and Kin Peak Body. So that has just been established. But that was really, that helps address some of the issues and recommendations that have been raised by major inquiries, including the Productivity Commission's inquiry. It is pretty exciting that that's finally happening, and that, you know, that will have a pretty big effect at a national level. You'll all be aware that we had a Queensland inquiry into improving mental health outcomes, and that pointed to system reforms, and it actually said the government really needed to continue to include the perspectives of people with lived experience and their carers in policy development and planning activities. So we agree, and we acknowledge the active involvement. We are trying to do better with incorporating perspective and views when we do our policy and planning. We have employed a manager and a project officer of lived experience, Craig Warland and Zoe Carr, and they will be helping us understand the issues, and hopefully, has Craig been out to see you yet? Good, okay. Yes, so that's just the start of how we want to try and improve things. But our Better Care Together plan, we're really trying to grow and enhance our services. And we have actually invested more than $3.5 million in new investments under Better Care Together, specifically for Arafmi. So I think that's pretty good. I don't know how much it was before, Irene, but 450,000. So you should be proud of the work you've all done and what Irene and the team have done to get yourselves to that level. That actually includes some important work, and I know Irene has spoken with you about this before, that Arafmi is doing a partnership with World Wellness Group to support culturally and linguistically diverse communities to better identify the role of carer. And so I think we really do need to ensure that we're broadening, getting a lot more cross-sector understanding of diversity amongst carers. Hang on. We did set up or support, and actually the Commission auspiced, but Queensland Health has invested in the establishment of the Mental Health Lived Experience Peak, but we really wanted to also support the establishment of a peak for carers. Irene and I have had discussions about that for some time. And there was some initial funding to support the development of a little bit of a framework. But we have now been able to provide the additional funding so that Arafmi can build upon all that initial work that was done to become a fully functioning peak organisation for health carers, family and kin. So we're really proud of that, and we really hope that that helps safeguard, like we want to hear the voices and help safeguard your important role in our treatment system. So thank you, and thank you Irene, Emma and the whole team for hosting the forum. You do an incredible job, and I just want to reiterate the support carers and families provide to the people you love, and that how much we value that contribution. Thank you. Oh, I didn't mention the numbers around psychosocial support. There is a gap of about 68,000 people, individuals in Queensland. So it's big, a lot of work we need to do to help close that gap.
We're very happy to be a soft spot for you, Sandra Eyre, and we do see some of the benefits coming through for mental health carers, and just hearing that number though, 68,000 people with psychosocial needs not being addressed by the system means 68,000 people relying on friends, family and kin to the largest extent. So, yeah, push on. I'm sure Irene won't hold back in telling you what she thinks needs to happen, and that's a great part of working for Arafmi as well.